Bismillahirrahmanirrahim. Assalamualaikum warahmatullahi wabarakatuh. Good morning, everyone. I'm very glad to be here joining the conference on community empowerment for health, which is conducted by Faculty of Medicine, Public Health and Nursing, Universitas Gadjah Mada. I also thanks to community that give me an opportunity to share my ideas and also our studies about the validity and reliability of interprofessional education assessment tool. Me and my team, we are me, Fatikhu, Yatuni, Asmara, and my team, Dian Puspita Dewi, Diana Nur Afifah, and Dr. Nur Kristina from Universitas Diponegoro. We conducted a study about how to develop the interprofessional education assessment tool. We know that IPE or interprofessional education is kind of educational approach that has been implemented in many contexts and settings. And as a part of the higher institutional education, Faculty of Medicine Universitas Diponegoro has implemented IPE program in community setting start from 2016. We involve students and lecturers from 3 programs, namely medicine, nursing, and nutrition. Then we do some research and studies to develop our program, including developing the assessment tool, because we want to know about the competencies achievement by our student and how they respond to the method of the assessment that we conducted. So this study aims to develop and to identify the validity and reliability of assessment tool that we have. We involve all of participants, 480 students, 39 facilitators, and also 5 experts in medical education. We conducted 2 steps, at least in this study. The first step, we developed the tools. We have 4 forms of assessment. The first is self-assessment for our student. The second is peer assessment. The third is assessment from supervisor. But then we ask supervisor to give score or to assess group and individually. After we develop the tools, we did the focus group discussion. We invite experts to give their suggestion on our tools. Then, after we revise the tool based on the expert suggestion, we moved to the second step to do the construct validity and reliability test by using the tools to assess the students' competencies. As we know that the competencies in IPE is at least 4 competencies. They are roles and responsibility, ethics and values, communication and team working. So we develop our tools based on the IPE competencies. Then after we did the construct validity and reliability test, we got the result. Even though the result is not like what we want, because we don't have a valid and reliable for self and peer assessment, but for the assessment from supervisor, both group and individual assessment, our tools are valid and reliable, because the score scores are higher than our table that we set. For that reason, it is suggested for the further research that we need to develop a valid and reliable for self and peer assessment. So we hope that this kind of series of research that we can conduct it, because for this year we are going to do the next research by developing the self and peer assessment. Why we think that self and peer assessment become important for our students, because we pursue our students to do the reflective practice, because it's kind of important for the adult learning. So that's why we still use self and peer assessment as our method for assess our student. I think that's kind of I can share for you all about our studies, and I hope we can get a lot of suggestion or information from you. If you have some experience that same what we have done in these studies, or maybe you have something that important for us to improve our quality of research. Thank you very much for the attention. See you next time. Assalamualaikum warahmatullahi wabarakatuh. Good morning.